A serious and potentially deadly condition that affects heart health during pregnancy is affecting more and more women. In fact, a recent report found that preeclampsia, which causes high blood pressure, is the most prevalent cardiovascular condition during pregnancy. And rates have climbed 25% over the past 2 decades. Cardiovascular disease is the leading cause of maternal deaths in these United States. It accounts for more than 1 in 4 pregnancy-related fatalities. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF, and she joins us now as part of American Heart Month. Dr. Gounder, thank you very much for being here. What makes preeclampsia, am I saying that right, so dangerous, and why are the rates going up?
Preeclampsia. So this is where you have high blood pressure during pregnancy, and it can cause organ damage, in particular to the heart, to the nervous system. So if it is affecting the nervous system, a woman could end up with seizures, she can end up with a stroke. High blood pressure can also lead to detachment of the placenta from the uterine wall, which is obviously dangerous to the pregnancy. Most of the preeclampsia is occurring at 20 weeks of pregnancy and after, but the definitive treatment here is delivery of the baby. So you end up with a preterm birth there.
So it can be treated?
It can be treated, but there are very long-term risks to somebody who develops preeclampsia during pregnancy.
So what are those risks for developing it? What can you do to prevent it?
Yeah, what causes it? Yeah.
Well, a lot of women are going into pregnancy much less healthy, so higher rates of high blood pressure, of diabetes, of obesity, so that certainly increases your risk of preeclampsia.
I was always worried when favorite daughter Kirby was pregnant, because she's black, as am I, that black women die in childbirth more than white women. Even educated women, black women who are getting good care, it's still an issue. Why is that?
Well, there are a number of factors. Women who are black are going into pregnancy less healthy, so they're more likely to have obesity, high blood pressure, diabetes. They also are more likely to have these other risk factors. They have less good access to health care. They're less likely to have health insurance. And they also deal with a higher burden of socioeconomic stressors than white women do.
How do women prioritize heart health after pregnancy?
So postnatal care is really important. A lot of women are overwhelmed after giving birth. They pay attention to the needs of the baby, but not to themselves. And about 40% of women do not engage in postnatal care, so care for themselves after a pregnancy. More and more states are recognizing the importance of postnatal care, that the risk extends out to 1 year after giving birth. And so more states are extending Medicaid coverage after delivery from 6 weeks now as far as out to a year.
Is there something that spouses can do? How can we be of assistance?
Oh, good question.
Well, support your wife so that she can actually take care of herself, so that she can get enough sleep.
That makes sense.
So that she can go out and get some exercise, so that she can get to those medical appointments. You know, make sure she prioritizes herself.
All right. Always good advice. Thank you, Celine Gounder. Always good to have you here at the table.